is Mara Francisca Basso from BSN 1B, and today I'm going to perform the physical assessment or the head to toe assessment. Physical assessment is a complete health assessment, may be conducted starting from the head and proceeding in a systematic manner downward. There are 4 primary techniques using the physical examination. First is the inspection, palpation, percussion, and auscultation. Inspection. Inspection is the visual examination, which is assessing by using the sense of sight, which should be deliberate, purposeful, and systematic. The second is the palpation. Palpation is the examination of the body with using the sense of touch. You will use this part of the hand to palpate your client. We have 2 types of palpation, the light palpation and the deep palpation. Percussion is a method of tapping body parts with fingers, hand, or small instrument as part of the physical examination. Auscultation is a process of listening to sound produced within the body. So what is the purpose of this physical examination? The purpose of this physical examination is to obtain baseline data about the client functional activities, to supplement confirm data obtained in the nursing history, to obtain data that will help establish nursing diagnosis and plan of care, to make clinical judgment about a client health status, and lastly, to evaluate areas for health promotion and disease prevention. And also, we have the special consideration. It is important to provide client privacy by closing all the curtains, windows, and doors. And of course, it is important to perform hand washing before and after the assessment to prevent cross-contamination of microorganisms from nurse to patient and vice versa. Then, before the assessment, we need to introduce ourselves first, identify the client, and explain the full procedure to the client first. Also, we need to make sure that the assessment that we are going to do is already being approved by the doctor. The materials that we are going to need for this assessment are drape, pen, light, ophthalmoscope, toning fork, percussion hammer, cotton applicator, gloves, tongue depressor, oximeter, and a stethoscope. Good day, ma'am. I'm Mara Francisca Basso, your student nurse for today. May I know your name and age po, ma'am? Okay po. So, today po, we're going to do your physical assessment. That includes the inspection, palpation, percussion, and auscultation. And also, we're going to do different positioning. Is that okay with you po, ma'am? So, bago po tayo mag-start, ma'am, gusto niyo muna po ba mag-CR kayo? Okay po. So, ma'am, pwede po pa-remove na po ng mga jewelry nyo para makapag-change na po kayo in patient gown or in hospital gown po para mas maging comfortable po kayo. Then, para mas mapadali po yung gagawin nating assessment for today. Is that okay with you, ma'am? Okay po. Thank you po, ma'am. Inspect each body system using vision, smell, and hearing to assess normal condition. Assess for color, shape, size, location, movement, texture, and symmetry. In palpation, we need to make sure that we use the pads of our finger, not the tip. Light palpation, the skin is slightly depressed. It is necessary to determine the details of the mass. Palpation, we also need to use the pads of our hand on the abdominal wall and apply peer pressure. Can also done with 2 hands or 1 hand. We can also do the deep bind manual palpation. And then document the findings. In percussion, we need to use the 3 fingers with the pad of our middle finger. I am using indirect percussion. This technique elicits sound that give clues to make up of the underlying tissue. And then document the findings. In auscultation, we need to use our stethoscope. We need to make sure that we warm our stethoscope first before we use it. Ma'am, please inhale po. Exhale. Inhale po. Exhale. Please inhale po. Exhale. Inhale. Exhale. So now po, ma'am, we're done na po sa physical examination nyo po. Thank you po for your cooperation.